Hello, and welcome to this session. Learning Outcome, LO6, understand and interpret data presented in various formats, including tables, graphs, and diagnostic grids. In healthcare, data is rarely just numbers. It comes in many formats, and being able to interpret them accurately is essential for making informed decisions. Data in healthcare is presented in various formats. Tables, graphs, and diagnostic grids each serve unique purposes. Tables offer precise comparisons. Graphs reveal trends visually. Diagnostic grids aid in decision-making. Tables organize data in rows and columns. This helps compare values across categories or time. Reading titles and headings is crucial. Identifying patterns is key. Tables are detailed, but require careful reading. This is a main call-out for this scene. Graphs provide a visual data representation. They make trends easier to spot. Reading titles and axes labels is essential. Checking scales prevents misinterpretation. Graphs are effective for quick pattern recognition. Diagnostic grids categorize results for decision support. They use thresholds and color coding. Identifying variables and cutoff values is crucial. Grids simplify complex data. They should be interpreted with other information. Each data format serves a different purpose. Tables are best for accuracy. Graphs excel in trend identification. Diagnostic grids support categorization. Choosing the right format avoids misjudgments. Understanding data formats is crucial in healthcare. It aids in accurate patient data analysis. Trends and risks are identified swiftly. Clear communication of findings is supported. This skill is vital for safe practice. Scatter graphs show correlations between variables. They require numerical and continuous data. Identifying variables for axes is crucial. Proper scales ensure accuracy. Each data pair is plotted as a point. A table shows exercise duration and heart rate. Duration is on the x-axis, heart rate on the y-axis. Each row becomes a plotted point. The points form an upward pattern. This shows a strong positive correlation. Scatter graphs reveal correlation types. Positive correlation means both variables increase. Negative correlation means one decreases as the other increases. No correlation shows no clear pattern. A line of best fit can clarify trends. Avoid joining points in scatter graphs. Ensure scales are even and accurate. Do not swap variables on axes. Always include units on axes. Correlation does not imply causation. Percentiles compare an infant's growth to a reference population. They show relative position, not good or bad growth. They are derived from standard growth charts. Percentiles are crucial in monitoring infant development. Weight percentiles require the infant's age and weight. The correct growth chart is selected. The weight is located on the vertical axis. The closest percentile curve is identified. This process ensures accurate growth assessment. Height percentiles mirror weight assessment. Age and sex are identified. Length is recorded in centimeters. This is a main call-out for this scene. The length for age chart shows the percentile line. This indicates the infant's growth status. Weight and height percentiles are assessed together. Proportionate growth is indicated by similar percentiles. Disparities may suggest concerns. Percentiles track growth patterns over time. Consistent trajectories indicate healthy growth. BMI is a measure of weight appropriateness for height. The formula divides weight by height squared. Weight is in kilograms, height in meters. Squaring height is crucial. BMI calculation aids in health assessment. BMI charts classify weight status. Categories include underweight, normal, overweight, and obese. They provide quick estimation without manual calculation. Charts are useful in clinical settings. They aid in rapid health screening. BMI is a screening tool, not diagnostic. It should be interpreted with other factors. Age, sex, and muscle mass influence BMI. Athletes may have high BMI due to muscle. Contextual interpretation is crucial. News assesses patient risk from vital signs. It converts data into numerical scores. Scores indicate clinical risk levels. News standardizes assessment across healthcare. It supports timely decision-making. Each vital sign has a score from 0 to 3. Scores are added for a total news score. The score indicates medical risk level. Higher scores require urgent response. News supports objective data-based decisions. News is not used in isolation. Baseline observations and conditions are considered. Clinical context and judgment are essential. News supports but does not replace assessment. It ensures data-based concern. In conclusion, data interpretation is vital in healthcare. Tables, graphs, and grids each play important roles, and mastering these formats ensures informed and effective decision-making. Should you have any questions, you're welcome to message us on WhatsApp at 07484361 688. See you at the next session. Thank you for your time.